Well, it's important to understand the cost of health inequities because it allows us to understand what's at stake. The discussion around health equity for years has almost positioned it as a discussion of them, meaning, what's happening and what we can do for those who are historically marginalized and underserved. And that is a very important discussion and a very actionable one. But what has also gotten lost in that discussion is this really is a discussion about all of us, and how we are all impacted by health inequities and the cost of health inequities. And the other thing is that it's important to show the cost because it's very easy to see in some of those figures how this is not sustainable. We cannot sustain this current trajectory of inequities that we are on. And action must happen now to address them. As we talk about at Elevance Health, our health equity by design approach, we recognize that we won't be able to achieve health equity within our organization, outside of it, and certainly as a society, if we don't do so with intention. Health equity won't be achieved by happenstance or chance. It will only be achieved if we embed principles in the design of everything we do, from our policies to our practices to our programs and to our interactions with our communities, members, associates, and certainly the leaders across our organization. And so as we talk about health equity by design, it's in how we get to know our members, from the very welcome call into a plan, whether that's a commercial plan, Medicare, Medicaid. It's in how we design our benefits or how we design our programs and products. It's how we review our medical policy and what gets approved and what does not. It's in how we make investments. Everything at its core needs to have health equity embedded. And if we are going to drive towards this outcome of achieving health equity when everyone has a fair and just opportunity to be as healthy as possible. The other piece is that, yes, education is one kind of tool, and there is no kind of one course that will make someone fully competent, right? Or arrive at eliminating their biases. We certainly recognize that this is a continual process of understanding what unconscious biases are, understanding strategies to mitigate them, but then have a continual learning and evaluation process. And we're building towards that. I think too is we want to ensure that we are incentivizing providers to deliver on the outcomes that we expect and obviously that the members deserve. So as we frame up our kind of quality metrics and equity metrics, we're ensuring that they include measures that allow us to both first identify where care gaps are or disparities and inequities exist, and then demonstrate to the provider how they are or are not making progress on closing those gaps. And that's part of kind of our value proposition as we talk about value-based care and creating incentives for providers to deliver on advancing health equity.